Good morning, everyone. My name is Mike Maymark. I'm the acting chair of Darchei Noam's Security and Emergency Preparedness Committee, and our committee has been charged with advising the board with regard to security issues and COVID-19 precautions. I'm able to welcome all of you to this morning's tutorial on masks and ventilation. Over the past many months, there's obviously been a massive amount of information circulating about those topics. But the arrival of the hugely infectious Omicron variant has, if anything, intensified our focus on the need to protect ourselves and others by wearing masks, for example. However, it seems to have become increasingly difficult to navigate one's way through the massive, sometimes conflicting information that we're bombarded with. Surgical masks are okay. They're not okay. It's better to wear N95 masks. No, N95 masks don't work if they're not fitted. Cloth masks are okay. They're not okay. Wear two masks, etc., etc. And ventilation? What? How? Is it okay to just wear a HEPA filter? We're therefore that Marianne Levitsky has kindly offered to present today's tutorial. She can give us some straight information. Marianne is a certified industrial hygienist. That's the profession devoted to assessing and controlling workplace hazards. She works with a consulting company, ECOH Management, and is an adjunct lecturer at the University of Toronto. She was founding president of Workplace Health Without Borders, a nonprofit organization devoted to promote health. Marianne will be providing us with information about respiratory protection that we hope you find useful this morning. There will be a question and answer period at the end, and Marianne has indicated that she wants to leave a lot of time for questions. And now, thank you, Marianne. Looking forward to this.
Okay, thank you very much. And thanks to all for coming, and thanks, Mike, for organizing this. We're almost 2 years into the pandemic, and so you might be asking the question, why now are we having this session on masks and ventilation? I'll talk about that in a minute. And here are some of the other things I'd like to cover this morning. As I said, I would really appreciate a lot of questions, so I'll try to leave a lot of time for that, willing to stay later if people have questions or answer questions offline. So why now? Well, here's a graph of the incidence of COVID with that latest spike due to Omicron, as we all know. Things have changed a lot since the beginning of the pandemic, especially with regard to, as Mike said, advice about masks or respirators and ventilation. Omicron is so infectious that the previous measures we were doing are not enough. So there is a renewed need for better respiratory protection. And we're in a crisis point, as I think you probably all know, in terms of the numbers which are threatening to overwhelm our hospitals. So even though some people have said things like, well, we're all going to get it eventually, so why not just give in? Even if that were the case, it's a good idea not to get it right now when the hospitals are so overloaded that, God forbid, you should need healthcare, you might have a hard time getting it. So we really, I think, all have an obligation to try to contain the infection as much as we possibly can. Also, better quality masks are now more available than ever. At the very beginning of the pandemic, I'm sure you remember, we were all told, let's retain the N95s for the healthcare workers, so we should use cloth masks. But that's not the case now. We have a lot of Canadian manufacturers making the equivalent of N95s. So better masks, respiratory protection are much more available. And that's why those of us in my profession have been advising that people improve their protection. So I just want to give you some basics of aerosol transmission, which kind of inform both masks and ventilation. You may be aware there's been a lot of controversy over the last 2 years about whether COVID is transmitted through the air. And I think finally it's kind of well recognized by most people that yes, it is. It's something industrial hygienists have been saying since the beginning. So just to set the stage for what we're going to talk about, because this is relevant to both masks and ventilation, just a few basics of aerosol transmission of SARS-CoV-2, the virus that causes COVID-19. So when we breathe, or we sing, or we talk, or we laugh, we are emitting aerosols, small droplets of liquid with some solid stuff in them that come out of our respiratory system. And those things are in very different sizes. So the large droplets, which we kind of heard about at the beginning, that was the main cause of infection, they're larger than 100 microns, and we measure these things in micrometers, that's a millionth of a meter. The large ones can spray onto somebody and infect them kind of directly. And those are the things that happen at close range. But the smaller ones can stay in the air for kind of a long time. So if you're standing close to somebody, and we all know the 6 foot or the 2 meter rule, if you're standing close to someone, A, you could get sprayed by those droplets, and B, you're kind of in the area of the highest concentration of those smaller aerosols. So you're much more likely to be infected at close range. And that's the reason for the 6 feet rule. The problem is, if you're in indoor space, those aerosols that stay airborne are going to float throughout the air. If the person is infected, they're going to contain virus in those aerosols, and they're going to start filling up in the room. So even if somebody is far away, like this other figure here, if that concentration of aerosols builds up to a critical level, they could inhale what we're calling an infectious dose and get infected. So this is the reason both for ventilation and for respiratory protection that I'm going to talk about today. So you may have seen this diagram before. There've been a lot of iterations of it. This one is from the New York Times, and it kind of shows that preventing COVID is a multi-layer process. At this point, we have to pull out all the stops. So it's kind of the analogy of Swiss cheese. Every single layer of Swiss cheese has holes in it. But if we're lucky, the holes don't line up. And if the COVID will be stopped by one barrier, if it's not stopped by another. So I'm not saying that masks and ventilation are the only thing we need to do, but there are two of the important things we need to do that may not have been addressed adequately already. And besides, in my profession, industrial hygiene, they're two of the things that we most use in our toolbox. So they're especially something I'd like to talk about now. So you can see masks and ventilation are two of the Swiss cheese layer in this multi-layer toolbox that we need to prevent COVID. So let's talk a little bit first about masks and respirators. Well, you might be wondering why I'm using these two terms. Again, in our profession, which is largely about preventing work-related hazards, we generally talk about respirators. They need to be approved. They need to meet a certain standard to protect the wearer from hazards in the air. So a respirator is kind of a subset of masks. Masks include everything we've been using to cover our faces, but respirators are the ones that meet a particular standard. So today I'm going to use the word masks, and you will see that some of them are respirators. So what is the most important thing about respirators or masks? Well, we like to call it the 3 Fs. And actually, I'm crediting here the slides that look like this are from my colleague Simon Smith, who's kind of a real expert in respirators. And he kind of told us about the filtration, fit, and function, which we've been hearing about a lot in the media, originating with Simon. So the 3 things we have to remember for respirators are filtration, how well the material used removes particles from the air. Does it fit? Like if it has fabulous filtration, but the air is leaking around the side, we're not going to get very good protection. And then function relates to the usability. Can the user breathe through it comfortably? Is it comfortable to wear? Because if it's not comfortable to wear or they can't breathe, they're not going to wear it and it won't be useful at all. So in evaluating something we put on our faces, those are the 3 things we need to remember. So I'm hoping this is not more than you ever wanted to know about filtration, but I think it's going to be useful to you to learn a little bit about how filtration works, because there's been some misinformation out there. Now, this graphic is from a super interactive page on the New York Times website, and I have the URL on the next page. I urge you to go to it because it's quite neat and it will explain a lot of this to you. But this is a magnified view of the fibers of an N95 respirator. And if you go into the interactive thing, it's going to explain to you that there are different size particles, which we've already seen, but they are trapped in different ways. So the larger particles kind of bump up against those fibers, just like a sieve. Like we tend to think of filters like a sieve, a colander. It only catches a certain size and anything larger. But that's a myth. In fact, it catches particles across a whole range, even things that would fit through the holes. So the larger ones, yeah, they capture them like a sieve. The smaller ones kind of get bounced around. You might remember from chemistry, there was something called Brownian motion, and they get slammed into the fibers as well. And then the N95 respirators that we've been talking about a lot have an electrostatic charge. So they capture the particles through an even different mechanism. So there's all these different ways of trapping those particles. And I'm not going to go through the science of this, but what I want to show you here is that there's all these different mechanisms and they work differently for different size particles. And then this black line up here, I hope you can see my cursor, is the total. So when we measure 95%, and N95 refers to 95%, it means it's capturing the most penetrating size particle. That's 95%. But you can see all the other sizes are captured at more than 95%. So people say, one of the myths we've been hearing is, oh, at N95, it's only getting 95% and it's only getting 0.3 micron particles. So what good is it? The virus is smaller than 0.3. Well, two myths there. One, yes, the virus is smaller than 0.3, but it's usually inside an aerosol that's bigger. And two, it's not just getting 95% of the particles, it's getting a lot more than that. So again, that's some of the things maybe you can remember as you go about evaluating what kind of respiratory protection you want to wear. So let's take a moment to talk about some of what these terms mean, because there's a lot of these terms floating around and it might help you to know what we're talking about. So first, a respirator, a filtering facepiece respirator is kind of the generic word for what we've all been calling an N95. It means an approved respirator in which the whole facepiece is the filter. What does the N mean? Why do we keep saying N95? Well, that's a term, again, used in industrial hygiene for respirators that don't protect against oil-coated particles. So it's of no interest to you. You're not like worried about oil-coated particles, but that's why we call it an N. If it was a P95, P stands for petroleum, it would be protecting. So if you happen to get a P95, don't worry, it's very good. It'll protect you against more stuff that you don't really need. 95, as I said, refers to the percent capture of the most penetrating particle size. So 99 says it's 99%. If you have an N99, 99%, so it's even better. So again, if somebody gives you an N99 respirator, take it if it's comfortable. It's even better than an N95. Then we have some other standards. KN95 means it needs a Chinese standard, KF94, a Korean, FFP2, a European. European also has FFP3. PFE, you'll see that on a lot of masks. It refers to particle filtration efficiency. So it's like similar to what the 95 means in the N95. If it says PFE 95, it means it's capturing 95% of the most penetrating. So then what do we mean when we say NIOSH approved? NIOSH is the US National Institute for Occupational Safety and Health. And if it's approved, it means it meets their standard, which in North America, kind of the gold standard for approval. The Europeans have different standards. And they will meet a standard for filtration, breathability, and fit. And all the NIOSH approved respirators are headband only. So the Earloop ones are not NIOSH approved. Now, we know it's kind of hard to get NIOSH approved respirators, and sometimes they're not the most comfortable, some of them. So since COVID started, Health Canada has been authorizing, they call it an interim authorization for masks and respirators. And I'll show you in another slide where you can access that list. So they will approve some KN95 and KF94 with Earloops, but they do evaluate them for filtration and breathability. Okay, so I told you that fit is a really big issue in masks and respirators. And how do we evaluate fit? Well, again, in the workplace, if this was part of the Occupational Health and Safety Act, you should be getting what we call a fit test very quickly, because I don't think most of you will be getting a fit test unless you're getting it for work. But it can be qualitative, which means not numerical, where somebody's kind of aerosolizes, sprays something that you can taste or smell. And if you taste it or smell it through your respirator, it means it doesn't fit well. Then we have a quantitative fit test, which uses a machine. And by the way, look at this respirator in this picture in the middle here. That's what we call an elastomeric respirator. It's a reusable respirator. And what this machine does is it measures the concentration of particles outside and inside the respirator, and it compares them. And to fit well enough, it needs to meet a certain standard of particles that are being filtered out. Then we have what we call a seal check, which I'll tell you a little bit more about soon, but that's something that you would do every time you put on a respirator, ideally. So my friend Simon Smith has demonstrated this. I just wanted to show you how an N95 will compare to an alternative. So this is the results when Simon did a fit test, quantitative fit test with an N95, and the green in these and the test shows that it passed on all these. And then he did it with a surgical mask. So you can see the surgical mask did not pass. It did not pass because the air is leaking around the side. And actually, surgical masks can filter very well. So they pass on that F. They're just not passing very well on the fit part. And then Simon kind of jokingly said, well, you could get something called a PALM, personal aerosol limitation module, his words. And you can see it will kind of do as well as a surgical mask in terms of fit. So you've learned a little bit about how comparisons of surgical masks to fit tested N95. But the research always says that even if you don't fit test an N95, it can still provide better protection than a surgical mask and the typical cloth mask. So this is a chart from University of Minnesota, and you might be interested in the leakage levels here for these different things: a non-fit tested N95, a fit tested, and a typical surgical mask. You'll see it's 50% non-fit tested, 20% leakage, fit tested, 10% leakage. This compares the person, the one you want to protect, and this compares the source, because remember, the masks we're talking about now want to prevent emissions from an infectious person, as well as protect a user from being infected. And the interesting thing about this chart is the times here show, remember that old advice about 15 minutes, do not spend more than 15 minutes near an infected person? Well, forget about the 15 minutes, because Omicron is a lot more infectious than that. But this illustrates the comparison. So they said if you could have two people, one infected, one not, together for 15 minutes and be okay, if they were both wearing N95s that were not fit tested, they could be together for 12 hours and still be okay. Gives you an idea of how much protection you will get from each of these different face coverings. But don't take it from me. Now, I don't know if all of you like Bernie Sanders, but he has a way of putting things, so.
But these are very different masks in terms of their effectiveness. This is an N95 mask. This is just a mask that most people use. The truth of the matter is a mask is not a mask. An N95 mask is far, far more effective in protecting the individual and also stopping the spread of the virus to other individuals.
Okay, so he does that, as I said,
But
he has a way.
these are
Whoops, I'm
very
trying to go on, Bernie. Hard to get him to stop. As he's kind of say, you have masks and then you have masks. I think that was the way he was trying to put it. Okay, so if you have a headband, like a proper N95 or something equivalent, how do you put it on to make sure it's going to fit really well? Well, there's a graphic, an explanation here. I have a link here. But I also have a little video I'll show you. Now, this video was made for nurses, so it's not necessarily applicable to everybody, but I think the part about putting it on and getting the seal check is good. So I'm going to try to advance to that part, and we'll stop it when she gets into some other things. Oh.
Hold the respirator in one hand with the front of the respirator touching the inside of your hand. The metal nose piece should rest near the fingertips. Be sure the top and bottom straps of the respirator are hanging down below your hand and are not tangled or twisted. Take the respirator and place it over your nose, mouth, and under the chin. Hold the respirator in place with one hand. Use your free hand to place the straps on your head. It's very important the straps rest on the head and that they are not overlapping or tangled. First, take the top strap of the respirator and place it just past the top of your head, above the ears. Then take the bottom strap of the respirator and place it around the bottom of the head, just below the ears. Again, make sure the straps are not crossing or are overly twisted. To ensure a proper seal of the respirator around the nose area, use the fingertips of both hands to bend the metal nose piece around the nose, starting in the center and working your way outward on each side. Now perform the seal test. This is performed to check if you have donned the respirator correctly and that it does not leak air. Always follow the manufacturer's guidelines for this part because it can vary between brands. Take a sharp breath in and make sure the respirator is sealing over the face during inhalation. Keep both hands on the respirator, breathe out. While breathing out, make sure you feel for air leakage around the nose piece and around the respirator's perimeter. If leaking air around the nose piece, try rebending the nose piece with both hands and recheck the seal. If air is leaking around the respirator's perimeter, try readjusting the straps and recheck again. Make sure the respirator is not being affected by any piercings, facial hair, or glasses, which could prevent a proper seal. If respirator still leaks after this, you may need a different size or type of respirator before use. Now to doff or take off the mask. Two things you want to remember is that you don't want to touch the front of the mask because it's considered contaminated, but you can touch the straps of the mask because these are considered clean. First, you will take your hands and you will remove the bottom strap by pulling it over the head. Then you will take the top strap and pull it over the head. Be very careful not to touch the mask. Now you can dispose or reuse the mask.
Just wanted to let you know there are different kinds of masks, so they won't all look like that when you go to put them on. And many of them these days are coming, they're kind of folded, right? Here's one that's actually Canadian made N99 or equivalent. And so when you get that, look at the instructions. If you get something like this, you have to unfold it first. And then you kind of have to get it on your chin isn't quite as easy as what she did, but you can still hold it. You can see this like she did, right? Open it up and then just sort of, I'm not going to put it all on, but just, it's a very similar process, but there's some different things for different kinds of masks. So just wanted to let you know that. Okay, so some other things about using a FFR, filtering face piece respirator, like an N95. Facial hair where it contacts the face will prevent a good seal. So I know a lot of men in our congregation have beards. You're not going to get a good seal with a beard, so just be aware of that. For COVID, we're advising against using the models with the exhalation valve. I think you see a lot of them like that, because again, we want it to prevent emissions of infectious aerosols if you should be infected. In industrial situations, we don't really care. We don't have somebody emitting asbestos, for example, so we don't care about the exhalation valve. But in the case where the user could be both a source or a recipient, we want to prevent them from emitting infectious aerosols. So do not get the respirators with an exhalation valve. Get a lot of questions about whether you can reuse respirators. you know, some of the better ones are kind of expensive. So people don't want to use them once and throw them away, even though they were initially designed to be disposable, and they are essentially disposable. But yes, they can be reused. If you don't get them wet or you don't get them dirty, you can reuse them. In between uses, it's really important how you store them. So they need to be stored in a clean and dry area. I hang them up. I have a particular place where I hang them. But another way to do it is in a paper bag. You don't store them in plastic bags because they won't breathe. So you want them to kind of air out. So you can put them in a paper bag. One thing that you could do is get about 7 paper sandwich bags, label them for every day of the week. And then when you use one on Monday, you can put it in the Monday bag, and then you can use it on the next Monday. I mean, you don't have to do it like that, but a good thing about storing them for a week is if there's anything contaminating, anything infectious on them, that usually it will not survive for a week. So you can be fairly confident using it again a week later, and it's a good way to remember what day you wore it. So that's my advice about reusing. And they can be reused, I would say, at least five times, probably more. So there is a problem with getting NIOSH approved respirators these days. It's rather hard to get them. And as I said, they could be expensive, although not all are expensive. But so what else could you do? Well, first of all, if you do get one that says it's NIOSH approved, I would recommend you check, because there's a lot of counterfeit respirators and masks out there. So if it says it's NIOSH approved, here's the website for the lists of, for NIOSH's lists of approved respirators. So check that out. Then, as I said, we have all the other ones, KN95, KF94, the ones that are made in Canada, that are essentially equivalent, but they're not NIOSH approved because they just haven't had time to go through the NIOSH approval process. And NIOSH is not really in a hurry to approve foreign made, from their point of view, non-US made respirators. In fact, we have a new Canadian standard now, so that's not going to be such a problem. But so far, nothing's been approved under the new Canadian standard. So what to do? Well, Health Canada has been doing what they call interim authorization of a lot of COVID devices. And here's the website for that. And you can search for a particular brand. So what I would advise, if it's something listed as being any of these things, go on Health Canada website and see if they're authorizing it. And if they are, then I would take it as equivalent. Now remember, KN95, KF94, most of them are Earloop masks. You won't get as good a fit with a headband mask, but it will mean that the filtration meets those standards. Then we have a surgical mask. And with those, I think you probably know what those look like, the blue ones. Sometimes they were yellow in that picture I showed you with Simon before. And some of them are ASTMs, the different standards, a standard for medical masks called ASTM. So look for those that say they are ASTM approved, at least get that. And as I said, their filtration is quite good, but the problem is they don't fit. They generally have a gap at the sides, at least at the sides, maybe elsewhere around. So what can you do? Well, in another slide, I'll show you how to get a better fit with a surgical mask. And then there are cloth masks, which we all got to know very well through most of the pandemic. There's been a lot of advice about how to get better filtration from a cloth mask. Again, now people aren't advising them now, but still there's a lot of them around, and a lot of us have made them. So at least have one that is 3 layers at least of tight woven cloth on the outer layers, with the polypropylene inner layer will give you the best filtration. And then don't forget elastomeric respirators. Some people may want to wear them. Remember, I pointed out a picture of one a few slides back, and the background of this slide is an elastomeric, the reusable respirators. I know people may feel it seems above and beyond for ordinary situations. There are some that are maybe not as intimidating looking as others, but they are not a bad choice if you feel that it's really important to you to get really good protection. And they will provide even better protection usually than an N95. Okay, what else to do? Well, in a pinch, this is just kind of, yeah, HEPA can be a mask. I'm not recommending this, but I thought it was kind of cute. Early days in the pandemic, when people were doing a lot of homemade masks, people were making them out of HEPA, so that's kind of neat. And then Alan, my husband, has pointed out to me, there is the fourth F, not just filtration function, but fashion. People don't want to give up their fashionable cloth masks. Alan got really used to being the man in the polka dot mask because this mask was a fundraiser for a hospital, of which he's on the patient council. So he just wears it on top of his N99. If you can breathe through it, that's fine. You don't have to throw away your cloth masks. Okay, I mentioned getting a better fit with a surgical mask. So there was actually done a study by the US Centers for Disease Control. And this is on a dummy, but they did a lot of testing, measuring the particles inside and outside. So you can see an ordinary surgical mask will often have a gap at the side. So they tested two things. One is a knot and tuck, and I'll actually stop my slides for a minute to show you that. They did test double masking. So a well-fitting cloth mask on top of a surgical mask did very well to improve the fit, as well as this knot and tuck method. And I'll just show you, they actually tested the results for those of you who like graphs and numbers. I have a reference here. I'm not going to spend a lot of time on it, but just to show you that, look at these blue lines are like the user protection, the light blue lines. This is without any particular, just the reticle mask by itself, this light blue line here. This is a double mask, much lower particle count. That's what these lines are measuring. And then the knotted and tucked had lower, but not quite as good. So I'm going to stop share for a minute. So again, if here's one of those surgical masks, and what you do is put the two edges together and tie a knot as close as you can to the surface, the mask. And then if you push through the, you want to have, actually I'm doing it backwards, but you want to tuck it like so it's very nice and neat. And I'm terrible at doing things nice and neat, but you can probably do it better. If you can see that, it's a very nice and neat kind of little fold. And you get a lot better fit with it, or double masking does even better. So that's something you can do if you don't have something better. Okay, so what about the Earloop masks? As I mentioned, a lot of them available now. It's kind of hard to get headband masks in some places, but if you have an Earloop mask, it should have a nose wire, some bendable thing at the top, like the N90, like the headband one. So put it on in the same way, mold it to your face the way they showed you in that video, and sort of try to mold it around and get as good fit as you possibly can. Then you can also have these other tricks to make it fit a little bit better. So I have a few of these here. One is cord locks, and you can just put these on. If the ear loops are too big, you can put these locks on the cords and shorten them, and they might fit a little better. The other is a mask brace, which I had, but I don't have right now, which to tie it around the back to make it fit better. And then there's something called a mask brace. It's in that picture. I ordered these. I don't like them very much. If anybody wants them, I'll give them to you. But they are an option for getting your mask to fit better. So that's kind of a diagram of it. And all these tips are at this website. So where can you get these? It's getting a little hard to get good masks. There's been quite a run on them, but here are a bunch of sources. Staples hardware stores, they actually have a fair bit of N95s, not so much the really comfortable ones, which are those trifold ones, but the ones that you kind of saw in the video, they do have them. Safety supply stores have them. Amazon has a lot of masks, but I would say be very careful because I think there may be counterfeits on there. Check the brands that on the sites that I mentioned to you. This is a really good site, Canada Strong Masks. You can buy directly from them. You can buy directly from the manufacturers. Masks for Canada lists a lot of sources. If you want to check out different brands, this person here at Mask Nerd, he has a website. He does a lot of testing of masks, including children's masks. He's in the US, but you might get some idea about brands there. I'm going to start speeding things up because, as I said, I wanted to leave a lot of time for questions. So I did say I would talk about ventilation, and I'm not going to talk a lot because it's complicated. I don't want to tell you more than you need to know. I'd be happy to answer questions about it. But this is a diagram kind of showing you what you need to be concerned about in ventilation. So we mentioned a few slides back at the beginning, the aerosols can stay suspended in the air for hours. If you're up close, those 2-meter range, ventilation isn't going to do you much good because you might get sprayed by those droplets, or you might be kind of in an infectious cloud being emitted. So stay far away. Ventilation isn't going to help you at close range. But in what we're calling far field, we want to reduce the concentration of aerosols throughout the room. So how is that done? Well, if you have a building ventilation system, you want to get it up to a certain level. I'll tell you about that in a minute. And here's a diagram of that ventilation, and the air will go through a filter. So what you want to do is maybe improve that filtration in the ventilation system as much as you can. And if that isn't good enough, you might want to get a portable air cleaner in the space. So again, in the interest of time, I'm not going to spend a lot of time on that right now. Generally, we've been saying 5 to 6 air changes per hour. Air changes means that the air in a room is totally changed over. That's 1 air change. So if it's got 1 air change in an hour, it'd be 1 air change per hour. So we're saying 5 to 6 air changes per hour is generally recommended for COVID if possible, but that can include fresh air, but also air that's going through an adequate filter. We have been recommending MERV 13, and MERV is just a measure, an indicator of level of filtration. So they generally go from up to 16, maybe 17. But MERV 13 filters in a ventilation system if the system can accommodate, but just don't go stick it in the system without getting somebody to say, yeah, this will work, because it might overtax the system and then you're worse off than you were before. And then we have some guidelines for carbon dioxide levels, which is an indicator of fresh air, because people breathe out carbon dioxide. It's not enough fresh air, the levels are going to go way up. So it's an indication of how much ventilation you're getting. And then there's a lot of good resources online. Here's one calculator you can use that can calculate if you're getting the recommended air change per hour, as well as some other things that it will tell you, like, carbon dioxide, and it will help evaluate your portable air cleaner, which has a measure called CADR, which is clean air delivery rate. So it's a measure of ventilation, of purification. Here's some other good resources. This site, Clean Air Crew, is really good for both masks and ventilation. Lots of information on it. Harvard has some very good resources, although their website, there's something wrong with their website today. I was just trying to get the link for you and there's something wrong with it. But they have some really good calculators for portable air cleaners, also for evaluating ventilation, mainly for schools, but it can be applied to other settings. And there's been a lot of interest lately in this thing, the picture here, which is called a Corsi-Rosenthal box, which is a do-it-yourself air purifier that can be made, they say, for less than $100. I think it's 100 US, but it's by buying MERV 13 filters, making a box out of them and putting a relatively inexpensive fan on that. And voila, you have an air purifier that costs somewhat less than if you bought one. And a lot of people are making these and putting them in schools. So that's kind of, I think, my whirlwind tour of masks and ventilation. As I said, I didn't want to say too much or talk for too long because I wanted to leave time for questions.
But maybe I'll start with some of the questions that have come into the chat while you've been speaking. One has to do with the challenge that you mentioned about men with beards. And what do you recommend?
Well, if I was in an industry situation, I know what to recommend. So whether you want to do it or not, that's up to you. But there's something called a powered air purifying respirator. And that's what it doesn't depend on having a good seal to the face, because what it does is it pumps air through a filter mechanically and blows it into the face piece so that you're getting positive air pressure coming into your face piece. And that will sort of account for the fact that you're not getting a good seal. So you could go to something like that. They're expensive, but that's one option. The other one is shave. I would recommend that you shave. You don't have to shave the entire beard. You can just shave where the respirator is going or the mask is going to touch the face. And while we're in these extremely kind of crisis situation, I would suggest that if at all possible, it's worth doing that.
Well, I'm sure we have some men who will be very hesitant. However, your advice is duly noted. Harold Brief asks, I have a mask with a pouch into which I insert a PM 2.5 filter. How does this compare to N95?
I would say it's not as good. I mean, it's better than one that doesn't have the filter, but for one thing, I assume it's probably like a cloth mask, so you probably won't get as good a seal as you would, tight a seal to the face as you would with an N95. Also, when you insert the filter in the pouch, it's like the filter is only covering part of the mask, right? Whereas if you had a mask that was made with an inner filter, it would be over the whole mask surface, so you would be getting better filtration. So better than some of the alternatives, but not as good as others. By the way, back in the days when I was making masks, because I did, as a lot of people did, I did buy some of the recommended polypropylene, which is good. It's the recommended inner layer. And if anybody's still making masks, I don't think I'll be making any more, so I'll share it. It's washable, it's usable, it's a good option if you are making masks.
All right, there are more questions in the chat, but why don't we sort of go to some of the people who've raised their hands. Mitch Rothman, I think you raised yours. You have to unmute.
Yeah, you can unmute.
Mitch.
You're still muted. I'm gonna
Okay, there we go. Just quick about where you can get them. I live, as you may know, about a block from Starkman Surgical Supplies at Bathurst and Davenport. And you can buy, these are full N95s, NIOSH. These are a Canadian one. And you can get either of them for $40 for 20 of them.
Great, good to know.
But you can just walk into the store. At least every time I have walked into the store, I have had no trouble buying as many of those as I want. So just in terms of where can you get them, many of us live close to there, and you can just go to Starkman's and get them. Thanks.
Wonderful, thank you.
And I'll just mention that Marcia said that while you were speaking, she went to the Canada Strong website and everything was sold out.
Yeah, a lot is sold out there. I just ordered some. Well, the thing is too, some of them say they're back ordered. They're available in a week or so. So if you can get by for a few weeks, you can do it. Also going straight to the manufacturer, it works. I have some, they're supposed to arrive on Monday. Hopefully they will, that I got straight from the manufacturer. Yeah.
All right, another question. Leon, you've got your hand raised.
Okay, thank you, Marianne. Fabulous presentation, learned a lot. I focus on the second topic that you addressed, which is the ventilation. I'm an engineer, and I'm involved in technology development and technology promotion. And over my shoulder, you can see that white box over there, that 1 foot by 1 foot box, is a device from Israel that is a HEPA filter, uses UVC, ultraviolet, to kill or disable the virus, and also ionization. And just entered the Canadian market. We were interviewed on CTV last Sunday. There's a couple of press releases that are coming out this week. And it's rated, by the way, MERV 17, which is much better than MERV 13. These are the current standard. My frustration as an engineer is that there seems to be very little focus on the ventilation of buildings. The only thing that we've read about and the only thing that we've seen are portable units like the ones you just showed us before for classrooms, which is great. We want to keep our students safe, but for all the other types of buildings, everything from homes to high-rise condos to shopping centers, that there seems to be very little media attention and very little discussion about the actual ventilation systems and opportunities to improve it. So I wanted to ask you, since you live with this every day, you're a professional in this area, why is it that there's so little attention to this by either, like I said, the media and the politicians, but also from the engineers themselves, including the operating engineers?
Well, that's a very good question. Well, from where I stand, there does seem to be attention on it, but you're probably right. It's not as widespread as we'd like it. There's certainly been a lot of attention on ventilation in schools, but part of it is it's not as easy to fix. It often is very expensive and takes some time to upgrade a ventilation system. So, kind of everybody's sort of looking for a solution they can do right away and inexpensively. So I think that's the main reason, but you're quite right. There's certainly a great need for upgrading our ventilation systems in most buildings, I would say. And hopefully that's something that is going to come out of this pandemic, as a recognition of that, and that things will get better. So thank you for pointing that out.
And for those in the room, at least now you know that there's at least one solution from Israel. It's actually the first of its kind.
I'm trying not to endorse particular brands.
No,
actually,
obviously.
Yeah. So if anybody has any questions about specific brands, I would rather answer that offline, but not in something being recorded. Thanks.
Oh, a good follow-up to that is a question from Dorit and Erez. I don't know if you know the answer to this, but the question is, how does the Darchei Noam's building's HVAC system rate for clean air replacement? What about specific spaces such as the sanctuary and washrooms?
Oh, very good. Okay, well, I'm not sure. I think somebody from the House Committee is here today. I did consult with the House Committee, and I did get the information from Darchei Noam's ventilation specialist about our ventilation system. So I was very pleased to learn it's very good. I understood they were putting MERV 13 filters in it. And, there were some areas where it may need some portable units. But in the sanctuary, the social hall, I thought it was very good. And again, since the House Committee isn't here, I would rather kind of discuss it with them. So maybe that's a better question offline to go into any more detail.
Julie Grossman has been waiting patiently.
Thanks very much. And thanks, Marianne. Excellent presentation. I'm a healthcare worker in a hospital and have been mask fit tested. I actually had to be tested again this week because this brand is out of stock and there's another brand. I've been using the medical masks. Thank you for the tip on the little loop things at the sides. My question is, should my employer, a very large hospital, be providing us when we have patient contact? Now I'm in orthopedics, not in COVID patient units, with N95s. Our manager has them locked in her office. And, if there's the odd occasion where we're concerned, we have to ask permission for an N95. And I know it's a dollar and cents thing, but should I be more aggressive? I also wear a face shield when I'm with a client. So I wear my mask and a face shield. When I'm walking around the building, I just wear a mask. Should I and my colleagues be pushier for them to supply us with N95s whenever we're in patient contact in clinics? I'd appreciate your input on that.
Yeah, my opinion is yes.
Okay.
Especially now, because what we're learning about patients in hospitals, it's not necessarily people who go into the hospital with COVID. It's people are going into the hospital for other things, but because, you know, the infection rates are so high, the chances of them having COVID are very high, even if they go in with something else.
So I'm in
So
an outpatient situation
Yeah.
as a physio, so they're in and out and in and out, and who knows where they are and with whom,
Yeah.
right?
and there are
So-
a lot of people. I mean, I generally think right now an N95 or equivalent is a good idea when you're indoors with a lot of people whose status you don't know. And I would think that would apply to the situation you're in right now. So
I figured you'd say that, but I wanted to hear it.
Yeah.
Thanks very much.
Yep.
Susan Glickman has both written into the chat and raised her hand. Susan, do you want to unmute yourself and ask your question? You're muted, Susan.
Yeah, we can't hear you, even though you look unmuted, but we can't hear you. No, now you're muted again. Are you sure your computer? Check your computer. You might be muted on your actual
If not,
computer.
I can read the question. from
Yeah,
the chat.
okay.
Okay, this is what Susan has written. We are looking to update our HVAC and spent quite a bit of time looking into HEPA filters, and we're disappointed by what we found. Complicated systems requiring several expensive filters, all needing frequent replacement, which means a lot of stuff to throw out that cannot be recycled. I'm now just considering getting a room HEPA filter for the living room where there is more likelihood of germs being introduced from people in the doorway. Is that adequate?
I would say that would be a good alternative if you're finding that it's just unfeasible or too expensive to upgrade your ventilation system in the filter. And it's true that home systems may not be able to accommodate, say, MERV 13, although there's some that are low resistance MERV 13s or higher that are better. So you might want to speak to somebody who knows about ventilation systems to see if there's some alternatives for you. But, you know, especially in situations now where there may not be, you know, people you don't know or status you don't know coming into your home very often. If you're worried about germs, you know, as sort of an air purifier in those areas can be a good alternative. Certainly may be less expensive, certainly, than upgrading your whole ventilation system. There's a lot of good air purifiers available now that have, you know, flow rates that are certainly high enough. The calculators that I showed you help you calculate the size that you need, the amount of filtration that you need, like that measure called the clean air delivery rate. Like an air purifier will tell you what their rate is, and you can go into these calculators and figure out if it's the right size for your room. So I would say yes, it's a good option.
So let me just jump in to say, I know that Marianne has said she's willing to stay and answer questions that remain. We are approaching the end of the hour. So what I'd like to do is highlight one question, and then people who need to leave can leave, and people who want to remain can remain. Does that sound okay? So here's the question, Marianne, from Dorit and Eris. They're wondering about how they can access the recording, and would it be possible to provide your slides or at least the URLs that were shown? So not just the images of the URLs, but links that people can actually click on.
Yeah, sure. I can do that. I actually was going to do it before this, but then I realized with those video clips in there, it makes a very large slide deck. So I think what I'll do, I'll prepare a version without the video clips. And then I will make that available. Like I have if you pre-registered, I have everybody's email, so I can send you a link to the slides. And as for the recording, yes, it is being recorded. I'm going to ask my husband, Alan, who does a lot of video editing, to edit it. And we'll see if Darchei Noam wants to put it up on their site. If not, I can probably send you the link myself.
Great. So let me just mention that the last large bunch of chats are all thanking you and saying this is just a wonderful presentation and people really appreciate the answers to so many questions, and that you were able to sum up so much useful information in a brief period of time. So, so thank you. for all of
Thank
this.
you. Thank you.
And be aware there are many thank yous. And then I would say, Mike, do you want to say something? And then if there are a few remaining questions, we can address them.
Probably as people are leaving now, would be a good time to do a formal thank you. So really appreciated, Marianne, the way you presented so much complex information in a really clear and straightforward way. As you can see, there's from all the questions, there's clearly a hunger for this kind of information. And we really appreciate you coming forward and volunteering your time and expertise to hold this tutorial. I also want to thank, who happens to be my wife, and Kathy Sikora, who's not, for co-hosting. And thank you all very much for coming. And if you're able to stay for further questions, please do so.
And thank you, Mike. Thank you for organizing this. And thanks to everyone. I'm glad you're interested in this.
All right, so let's go to some hands that are still raised. Susan Ewing, you've got your hand up.
Hey, Marianne, I know there are not a lot of babies in industrial workspaces, so this question may not be on your frequently asked list. But in about 2 weeks, we're expecting a new baby in our family.
Mazel
And I'm
tov.
just trying.
Wonderful news, yes.
Very exciting.
Yeah.
I'm just wondering what this is going to look like, even like in the hospital, walking around with the baby. Everybody will be masked, but obviously you can't mask a baby. What happens with babies? Do you know about this? Like,
well, I mean, I don't want to talk about the immunity of babies because that's not my topic. So I would certainly recommend, you know, that all the adults around the baby wear, you know, the higher quality masks, such as I talked about. You're right. I mean, Health Canada says, and so is NIOSH, don't put masks on children under 2 years old. So obviously we're concerned about protecting them from by source control. In other words, the potentially infectious people are the ones who should be wearing good masks. So that's what I keep that baby away from unmasked people, if you can. In terms of children's masks, if anybody, I know it's not in your situation, but I have been asked recently quite a bit about children's masks. Health Canada does not authorize and NIOSH does not approve masks for children. So, you know, it's a matter of sort of what the best advice is. I've been saying if the brand is, if that company makes Health Canada authorized or NIOSH approved respirators or masks for adults, I would say I would trust their children's masks. But that's kind of the best we can do. I am also worried about, you know, companies that may be making masks for children that don't have the qualities that we're looking for. And certainly filtration function is as much of an issue for children as for adults.
Mickey, can we go on to your question now?
Sure. When the original SARS-1 hit Toronto, I thought lessons learned were the fact that there was taping done around the masks.
Yeah.
So,
well, that can be done. Yes. I mean.
So why would we have forgotten the taping part when it's become so difficult to do do all the different tying parts?
Well, we haven't forgotten. I mean, people have used surgical tape to get better fit. That's true. It's not ideal because I really didn't want to recommend that because, you know, it can be painful to take off. It can be irritating. But if people are kind of stuck and they're not getting a good fit, I would say yes, that is an option.
Okay. Especially with the shortages. I'm only recommending because there is so much shortage that it's kind of it would seem to be an option that doesn't seem to get any air these days. Excuse
well,
the
that's
expression.
true. Yeah, that is true because it can be uncomfortable. It will be irritating. It can be painful when people take it off, etc. So yeah.
Thank you. Great presentation. Thank you so much.
Thank you. Thanks.
Judy.
Yeah, hi. Thank you very much. I found some KN95 masks that say that they're compliant with an executive standard GB 2626/2006. I think it's some kind of Chinese standard. Could you talk a little bit about that? I know it's probably not the same as the other ones, but there's so much floating around, and it's so hard to find the ones that have the Canadian or the US.
Right. Yeah. Well, KN95, as I mentioned, is a Chinese standard. It is a good standard for filtration. And our only concern is there's counterfeits around, that say they have it, but they're not. And that's why I recommend that you check that brand on that Health Canada site where I gave you the link. It has a searchable field. Just search for that brand. You will find that there's a lot of KN95s listed on that site. I've been pleased to find how many are in fact listed, and I would have confidence in them if they're on that site.
And just one other quick question. I know we're only supposed to ask one, but I'll just ask another quick one about wearing masks outdoors.
Yeah, well, it's funny because a lot of places, some countries say, recommend you have masks outdoors. My feeling is because essentially ventilation outdoors is very good. If you stay away from people, if you're not in a crowded space with a lot of people densely packed, I don't feel a mask is necessary because you can maintain that distance. The ventilation is going to be very good, so any aerosols that are emitted are going to be diluted and blown away very quickly. So the main time I would be concerned about wearing a mask outdoors is if I'm which I never am now, but if I were in a crowded, kind of densely populated place, then I would wear a mask outdoors.
Susan Bloom.
Hi, everyone. Thanks so much, Marianne. Wonderful presentation. My question is regarding living in apartments. Obviously, the building management, I don't know what they're doing about the ventilation system, but for individually in our apartments, if we want to get an individual air purification system, how do we figure out how many we need or what rooms to put them in?
That's a good question. Well, for one thing, ask the building management, find out as much as you can. Ask them what they're, is the air circulated, throughout the whole building? What kind of filters do they have in the system? They should be able to tell you that. It's not an unreasonable thing to ask the building management. But yes, an air purifiers in your own units is a good idea. And sizing them, again, is a matter of the relation between the room size and what the filter unit or the air purifying unit says is their clean air delivery rate, which is something measured in cubic feet per minute of air. There are other measures as well. And there's these calculators that I linked to that kind of help you figure out for a particular size room, what kind of, how big, what capacity in terms of CADR you need. So if you want, specific help, we can correspond with that offline. But when I send the link with the calculators, you can use that calculator to help you figure that out.
So, but besides the space, is it also a matter of which rooms, like ensuring that your bedroom and your main living space have one?
Oh, I see. Well, I'm more worried about rooms where you might have people coming into. So the bedroom I find good because not so much because it'd be infected, but it reduced the particles numbers when you're sleeping, which I may be good. But if there's a really good filter on the ventilation system, you may not need that. But something like a living room where you might have other people visiting, that would be the main one, I would say. Having it near the kitchen can be an advantage in other ways too, because it will take care of cooking, particles that are released when you cook as well. In our home, we did get one, again, inspired by the pandemic, but we find that it's really good to have on when we're cooking. It kind of helps a lot. So probably the living room area close to the kitchen is a good idea.
Right, super. Thank you so much.
Eris and Dorit.
Thanks a million, Marianne, and others who have been helping in this effort. regarding the taping that was just mentioned before, I find a couple of times I put tape just below my eyes on a surgical mask and found that it helps reduce fogging of my glasses, which of course means that there's some leakage, or at least the water vapor up through the mask. So surgical masks are not perfect. My main point that I raised my hand for is that I really urge that a link to all this material, to the recording, et cetera, be posted on the Darchei Noam website and also in the upcoming What's On email broadcast,
Okay.
as well as maybe some summary of some of the more important points of this, such as indicating, what level of filtration we have, the quality at Darchei Noam, so that people who are thinking of coming in for in-person services when that happens might be given a better sense of security, a well-informed sense of security. Lastly, about apartments, if the building's filtration system is not all that great, then it could be that what is being pumped into your apartment is not perfectly clean air, not sufficiently filtered air. So I wonder if that might inform where to place any filters that you might want to put into your apartment, maybe where vents are located in your apartment. Just a thought.
Thank you.
Yeah, yes.
Spoken like a true engineer. Elaine McKee.
Here we go, unmuted. Thank you. That was a wonderful presentation with so much good information. I just was wondering, I did get a portable air filter. We've got radiators in the house. So, I was hoping before Omicron came along that we'd be able to have the occasional socially distanced guest at our table with this air purifier. It hasn't really worked out all that much at this point. But anyways, I was thinking, should I be leaving it turned on? It's off all the time. I sort of think of it as something that I would turn on if I ever was able to have somebody in the house. But I just wondered your
Well,
thoughts
it's
or
interesting,
wisdom.
Elaine, I'm in exactly the same position as you. Same story. We got ours again, thinking we'd be having in-person guests before Omicron, and got it then. But what I do keep it on, but it's not obviously for COVID because we hardly have anybody. We haven't had anybody in the house except ourselves. But I have actually found that it's better. You might have noticed I have a cough. It's a chronic cough. I don't have COVID, but I have a chronic cough. And I have found that it helps, so there is a lot of particulate in the air, especially in a city. Again, cooking generates particulates. So I have found that it really helps to have it on. So I keep it on a lot, even though
it's
it's
a
not for
general
COVID purposes.
health.
Yeah.
General
yeah.
health as well as.
That's right. Yeah.
Thank you.
Yeah.
And Karen, I know you had a question in the chat that I had not yet gotten to, but I think that's why you raised your hand. So you are, I believe, the last question. Please go ahead.
Oh no, so much pressure to make it relevant. It's
A
not
really
as
quick question.
it's not relevant to most people on the call, but before things got shut down in the latest series of shutdowns, City of Toronto directive to arenas, city-run arenas, was that you needed to wear a mask to enter an arena and to be in the dressing room, and you had to be vaccinated, but that you don't wear a mask on the ice. So I stopped. I have not gone back to hockey, but all my buddies are playing. So so my question is, what are your thoughts about mask wearing? And some people are playing hockey outside, and you just mentioned about maybe it's outside it's not so important to wear a mask, but certainly if you're playing sports, breathing heavily, and now and then coming close to somebody like that, what is your sense about mask wearing? I mean, I certainly wouldn't do any of those things without a mask, but all my buddies are, so I'm quite concerned.
Yeah, well, again, like every individual situation, I mean, is different. I don't know what the ventilation is like. You know, you sort of have to balance the protection, you know, ventilation and mask and vaccination status are all go into the making up what is the level of risk in a particular situation. So I don't know what the ventilation is like in the arena, but I would kind of, again, there's something we call precautionary principle in our line of work, which is if you're uncertain, do the most protective, reasonable thing. I would say that that would be the most protective, reasonable thing in that situation. When people are engaging in strenuous physical activity, they're breathing so much more. I mean, the rates of breathing are just wildly different depending on the level of activity. And so higher breathing rates are going to do two things. You're going to be likely to inhale more if there's infectious particles in the air. But if somebody's infected, they're likely to emit more. So either way, that's going to raise the level of risk. Probably the ventilation and the distance will lower the level of risk, but on balance, I would say you're right. Wear a mask.
Yeah, and even if I were to wear a mask, if players around me are not, I'm breathing heavily. That's not a great situation. Yeah. Okay, thanks.
I believe we are at the end.
Okay. Good.
So thank you so much, Marianne. That was
Happy to do
terrific.
it. Okay, good.
Thank you.
Thank you,
Marianne.
Okay, take care. Thanks
Be well.
so much, everyone. Okay.
Thanks so
Yeah.
much.
Okay,
Thanks.
take care. Thanks.
Bye.
Bye.
Thanks, everybody, for coming. Thank you. Thanks again, Marianne.